Hello, my name is Corey Mills, and this is my medical terminology assignment for Ms. Nalyer's PTA 250 Therapeutic Procedures course. This presentation will be on the herpes zoster virus. So what is herpes zoster? Herpes zoster is an acute viral inflammation of the sensory ganglia of spinal and cranial nerves. This virus is typically associated with people who have had the chickenpox virus earlier in their lifetime or people who are affected by the HIV virus. Currently, this virus is uncurable, but it is treatable. So some signs and symptoms of this virus can be painfulness, itchiness, or tingly rash on the body. This virus mainly is found on the trunk, not crossing the midline. Occasionally, it can be on the extremities, such as the arms and legs. It'll typically be small little rashes all over the body, similar to psoriasis or eczema. You can have headache, sensory to bright light, and malaise. Malaise is basically feeling sick or nauseated, fatigued, or general discomfort. Shingles are highly contagious only whenever they are in their blister stage because of the fluid found in the blisters. Once that fluid dries up, it'll scab over or crust over and enter the crust phase. And basically at this point, it is not transmittable. But covering during the blister and the scab phase can drastically reduce the transmission rate between this virus and other people. So some diagnostic testing for this is the SAC or the SONC smear. Basically, they will scrape the area, send it off to a lab, and see if it is present for any SONC cells. If it is, then you are infected by the herpes virus. Some others are the Kodak SureCell herpes test kit and the viral tissue culture. The viral tissue culture is one of the more used. Typically, people who are infected by this virus are in a lot of pain, discomfort, itching. They'll go to the doctor and they'll take a culture of the area and see if it's present for any SONC cells. And same thing, if it is present, then you are positive for the virus. So current medical treatment options, you got pain medication, which relieves the pain caused by the rash. You have wet, cold compresses, which can drastically reduce the itchiness and inflammation with the infection. Oatmeal baths. Oatmeal baths are very good because oatmeal has a wide variety of uses with the skin. From moisturizing the skin to reducing itchiness of the ulcer bases. Serves as an emollient, which leaves a moisturizing film on the skin to alleviate the itchiness, and has antioxidants as well as anti-inflammatory properties. Calamine lotion does the exact opposite as oatmeal with the whole hydration thing. Calamine lotion actually dries out the area, so this would be best used when the blisters are on the skin. Because it will dry up some of the leaking and the weeping that the blisters do, that come out of the blisters. Antiviral medications, I've listed some down here. Typically that will help shorten the length, the time period of the ulcer bases. So some probable prognosis, rash develops into clusters of vesicles. Vesicles continue to form over the 3 to 5 days. So over this time period, they get bigger and more sensitive until they reach the scab over phase. At that point, they're just really itchy. The vesicles progressively crust over. So they dry out and crust over. They usually heal within like 14 to 28 days. Depending on the severity of the flare-up, they can leave scarring or discoloration of the skin. So some physical therapy techniques, cold wet compress to aid in the reducing inflammation and discomfort caused by the flare-ups. The only problem with this could be some people are very sensitive in those areas, so they might not be able to take the compression aspect. And these are my sources that I use: CDC, PubMed, and CDC.